Hi, this is Jerry Cobb. I'm Director of State Services for the BUILD Initiative and a partner in the National Center on Early Childhood Quality Assurance. And I'm pleased to welcome you today to the second webinar in our series on building the supply of high quality child care in high need areas. We really appreciate your joining us today to talk about identifying, mapping, and alleviating child care deserts. And we think this must be a really hot topic because we had over 700 people registered for this webinar today. So thanks for joining us. Before we get started, I wanted to go over a few housekeeping details. Due to the number of people who registered and in order to include as many as possible, we had to set it up so that everyone is muted today. And we apologize for that in advance, but really hope that it will not limit the interactive nature of this webinar. You all have the ability to write in the chat box. And so if you have a comment, a question, if you want to share something going on in your own state or community with the rest of the participants, then please do so. The last webinar we had a lot of dialogue going on between our participants and with our speakers as well. We really hope to encourage that again this time. You guys are the experts as well as our speakers in terms of what has worked and not worked for you in this area. So please do share your experiences via the chat box. And now I want to turn it over to my partner in crime, Zelda Boyd with the National Center on Early Childhood Quality Assurance.
Thank you, Jerry. Good afternoon, everyone. I'm Zelda Boyd with the National Center on Early Childhood Quality Assurance, as Jerry said. And for those who are not familiar with the Quality Assurance Center, I want to just take a quick moment and share with you our focus and to invite you to reach out to us if you have any technical assistance needs around the areas that we support. So we are jointly funded by the Office of Child Care, the Office of Head Start, and Maternal and Child Health. Priorities are to advance strong health, safety, and quality standards and licensing regulations. We focus on supporting the development and enhancement of state quality initiatives and also on enhancing quality assurance systems with things like technology, data analysis, and research. So the Center's contact information is posted at the end of this presentation, and we do invite you all to reach out to us if you have any technical assistance needs in these areas.
Thanks, Zelda. And if anybody is having any audio problems, if you'll put your message in the chat box, Jen Bender with our organization will respond and try and troubleshoot so that everybody can hear. Before moving on, I just want to share the overview for this webinar series. The last month we had our overview on the topic of building and financing the supply of high quality child care. This month the focus is on child care deserts. Next month we'll focus on financing. In May the focus will be on using grants and contracts and payment rates to increase supply. And then our final session in June will focus on innovative models related to facilities. So we hope that you'll find those helpful. Feel free to reach out and say, I'd love a different topic to be scheduled later in the year, and we'll consider doing that as well. We really, and as part of this series, we've also created a web page where you can go to register for the other sessions where you can get the recording for previous webinars, including this week's when we published it, where the PowerPoint is and any other resources related to each webinar. The link that you see on the screen and that you'll get in a email at the end of this webinar as well will take you to all of that information. So definitely take advantage of it. One of the things before we get started, and I turn it over to the speakers, we wanted to kind of get your brain going. There's been some big news in the past week about the fact that there's going to be quite a substantial amount of new CCDBG funding. So we'd like you to kind of put on your wishing hat and share with us if you could decide, and we know everybody's at different levels, but from your perspective in the role that you play, if you could decide how to use that new CCDBG funding, share that with us. And we'll use that, your responses also, as a way to think about how we can support you in thinking in that direction as well. So we'll just give it a few minutes and give it a minute or so, and then we'll move on to our speakers. So while people are putting in their wishes and dreams and ideas, I'll go ahead and start with introductions. We're pleased today, as part of this webinar, to be partnering with the Center for American Progress and Child Care Aware of America. Both organizations are doing a tremendous amount of work on child care deserts. And when they first showed us the work they were doing around mapping, and the potential to eventually have these maps for every state in the country, it was pretty exciting. In fact, I've been talking about this webinar to people ever since we had the initial planning call. And so they're going to share the approaches they're taking in their two different organizations. And then we'll also give you some very concrete examples of how states have actually used what they have learned from the mapping process to inform some of their policy decisions, and to inform spending decisions, as well as to leverage other dollars as well from the public and private sector. So there are a lot of good kind of concrete ideas that you'll get from this webinar. So hang in with us the full 90 minutes, and we will share as much as possible. Today's panelists we have from the Center for American Progress, Rashid Malik from Child Care Aware of America, Jen Bump and Dion Dobbins, and then from the state of New Hampshire, Tracy Pond, and from the state of Indiana, Natalie Brake. I'm going to turn it over now to Rashid Malik with the Center for American Progress, and we will reserve a little bit of time in between each speaker for questions as well. So if you have some immediate questions as he's speaking, go ahead and put them in the chat box, and if we have time to get to them, we definitely will. All right, I'll turn it over to you to kick it off, Rashid. Thank you.
Thank you, Jerry. For those of you that may be unfamiliar with the Center for American Progress, we are a progressive think tank located in Washington, D.C., and it's just really great being able to speak with so many experts and child care leaders across the country. So thank you to Jerry Cobb and Zelda Boyd for organizing this webinar series. I'll be definitely tuning in to the rest of the series. CAP does research in a variety of policy arenas, and we're very proud to have a dedicated early childhood policy team. Over the past couple of years, we have produced a couple of reports on the issue of child care deserts. So we feel that by assessing the overall licensed child care supply, this is going to give us an opportunity to really explain the unrealized potential of the early care and education field to the press, as well as to the typical uninformed policymaker. Usually they're quite familiar with the issue of affordability, but this child care deserts metaphor is really useful for talking about gaps in availability of really geographic proximity. And so we fully acknowledge that child care access is a very complex issue, and so we're not really just talking, we're trying to stay away from saying simply access, because that has to do with things as varied as the hours of operation, the price of child care, the quality, and different aspects. This is really just getting at geographic proximity and takes inspiration from the food deserts idea, which took hold a little over 10 years ago and really raised awareness around the need for more fresh food vendors in some rural areas and in some cities. So here you can see the cover from our report from last August, Mapping America's Child Care Deserts, and I will we'll have links to that in the materials at the end of the webinar, but you'll be able to just Google it and find it that way as well. So moving on, our work and child care research broadly is often concerned with these kind of 4 interconnected issues facing the child care sector. The quality of care, of course, QRIS has really taken hold and helped out there. Improving compensation and training for the workforce, which has had challenges with low pay and high turnover and challenges related to professional development. And then affordability, which is well documented, and many quality providers may not be affordable to some families. But we posit that the 4th issue facing the child care sector should be supply. And anecdotally, this is something you hear frequently from parents, and providers know well, I'm sure. And I'm a parent of 2 youngsters, and I am well aware of this problem. But we also saw in 2016 an NPR Harvard poll found that 2/3 of parents said they had only one or just a few realistic child care options. And so that really reinforced for us the need to try and quantify the undersupply of child care in some areas. Since, in a simple economic model of supply and demand, you'd think that affordability is directly connected to supply, but it's really not so simple, and I don't think I have to tell our audience gathered here today about that. So we collected public information on child care locations and their licensed capacity, and we compared that cumulative capacity against the surrounding population of families and young children. In almost every state, we were able to include family child care providers. Some states don't make that information public for privacy concerns, but I think in about 19 or 20 of the 22 states, we're including family child care. And spoiler, we found that more than half of the population that we studied, which covers about 2/3 of Americans, live in what we're calling a child care desert. So what makes a desert? I will actually get to that in a moment, but first I'm going to briefly walk through the steps involved in our methodology and our study. So the first step is in collecting, or really in this case more just downloading, child care location and capacity data. So I spent a lot of time on state websites of kind of varying usefulness, looking for downloadable data sets. And some state departments of human services or family services have really wonderful search functions that are extremely useful for families who are looking for child care, but you can't always download the full file. Others are a little less user-friendly to the layperson, but are housed on open data portals for researchers like myself on sites like data.gov, which is a great resource. The picture on this slide is an example of a fantastic web portal that the state of Pennsylvania has made, where you actually put in the types of providers you're interested in. If you want to just select by county, you can select the file type that you want, and then you actually generate a report, and like within an hour you get an email with a fantastic report, and you can actually select all counties and all types, and it was really one of the best. So going forward, we intend to, we'll be soliciting data from the other 28 states through other types of means, whether by phone or email, or through some type of technological techniques to kind of gather that information off of the search websites. But if any of the you that don't see your state represented in our report or maps have tips on how to get these files, just please let me know. We would love to hear from you. And we are committed to using this data responsibly. And as you'll see on our map site, we don't list any addresses or provider names. So next part that you would need to make some child care maps or desert maps is you need to select some other geographic information that you want to use in your analysis. So we were interested in the types of families that reside in child care deserts. What are their economic outlooks, prospects? What are the demographics of those neighborhoods? How many children live there? And the Census Bureau makes it really easy to download all of that information from American Fact Finder, the census data portal, and it's really relatively painless. The next thing that you'd need is some geographic information system software, or commonly referred to as GIS. GIS is needed for our project for two reasons. One is what's called geocoding. Geocoding is taking some street address and translating that into a latitude and longitude X and Y points that you can then use to place a child care provider or center within the type of geography that you're looking at. So we look at census tracts, which are roughly analogous to neighborhoods or towns. You could also do this by county or by city, and you need to kind of use the GIS software to get from the address to the location. And then you also need it to do your spatial analysis, and that's just a fancy way of saying counting up how many providers there are in your geographic entity, and then their cumulative capacity, licensed capacity. And so we had more than 45,000 census tracts in our study, so that wasn't really going to be something that we could just count up by hand. ArcGIS is the kind of professional standard, but a license can be pretty pricey. Most states and counties will have a GIS department and should have a license, but for smaller nonprofits that might be a stretch. QGIS is the kind of free open source replica of it and works quite well. It's free to download, but I would recommend seeking out a GIS professional to perform your geocoding and analysis. I know some people have reached out to geographers in colleges and universities that have offered to do things for free or kind of pro bono. This is really easy work for someone who's been trained to use GIS software. Finally, the thing to kind of pull it all together and do your analysis is, for a report like ours, was some kind of statistical and data management software where you're combining all of these different sources into one data set and then running your analysis. And I use Stata, but there are other types of programs out there. Not too expensive, but does require kind of a professional analyst to operate the software. So moving on, I'm going to get back to the topic at hand, which are child care deserts. So we needed to have a working definition to decide what's a desert and what is not a desert. And this is not a perfect science. This is kind of new, and so we take all criticism, constructive criticism. Feel free to offer insights or ideas for improvement. That's why we call this a working definition for child care deserts. I developed this simple algorithm that you can see in the figure from our report here. And it's basically any census tract where there are at least 50 children under the age of 5, and where there are there's at least one child care provider, if there's two versions. If you have at least 50 children under 5 and there are no child care providers, that's a desert. And if there are child care providers and the ratio of children under 5 to cumulative capacity is more than 3 to 1, that is a child care desert. So this 3 to 1 ratio comes from a report by a family demographer at the U.S. Census Bureau in a report called Who's Minding the Kids, which finds that recently as 2011, about a third of children under the age of 5 are in some kind of regular care arrangement outside the home. So our findings were, to summarize, that rural communities have the lowest supply. even when you include family child care providers. But low-income urban areas also see a lot of deserts. Overall, lower-income areas have fewer child care options. Notably, the exception, of course, is Head Start, which is really everywhere. More than 20,000 Head Start locations across sites across the country. We're working on a report on Head Start actually coming up, and it's just remarkable how far the reach of Head Start is, and early Head Start. Latino communities and American Indian populations are also more likely to live in child care deserts. And another interesting finding that we have that is not on this slide is that maternal workforce participation rates are much lower in child care deserts, and that association doesn't hold for men's labor force attachment. And so this is a kind of example of the two-generation effects of child care availability, in that it is quality child care is great for the kids, and it's necessary to working families. So the media really wants to cover this issue, but they really crave some hard numbers to pin down the magnitude of it. The cost of care is a really important story and gets great press coverage, but this is another area of public interest, and good journalists are able to track down plenty of parents who have had a hard time finding quality child care. It's really an emotional issue for parents, and hits home for their readers and viewers. So you can see here we've gotten a lot of traction with this project, and in part it's because some journalists have told us, we really love this data because it puts a hard number on something that is well known anecdotally, but this really quantifies it for people. And policymakers and leaders really want to quantify this issue too. They want something to measure so that they can address it. And since we're trying to cover as many communities as possible, there is often a local angle. Local numbers means a lot of local press, and it gets the issue out to people that other outlets might miss, and gets us really outside the bubble, especially for us DC researchers. There's opportunities for local groups and leaders and businesses to organize around this issue. We think that this should really be considered an aspect of local economic development, and we've seen this come up in rural areas recently in Minnesota and in Nebraska, where some groups have leveraged philanthropic investment or state planning resources to try and address child care supply in their town. And they're often talking about the issue kind of in the same breath as economic development. And so there's, I think, a real opportunity for, in these tight-knit rural communities and small towns to take a kind of collective impact approach to the issue of child care supply. It's really an issue of infrastructure, and that's one thing that we emphasize in our reports. So I'm going to take us over to our maps. We developed maps for the 22 states, and they can be found at childcaredeserts.org. I'm going to do a quick little demonstration. It's very easy to use this site. I hope you'll find it easy to use. And you can download the report in the top bar by clicking on this button right here. These are the 22 states in our study. And as you scroll down, you can actually see some national stats showing the share of people in deserts by race, urbanicity, and income, as well as the differences in the share of people in child care deserts by state in our study. If you actually click on a state, I'll click on Missouri here, you can scroll and move around. I can actually put in a zip code, and it'll take me right to where that zip code is. This is in Berry County, Missouri, which is in the southwest part of the state. And we can see the full county is actually a child care desert. This is a rather low-income area of the state. And if I hover over any of these census tracts, you can see on the right that some statistics, some census data comes up, showing that in this part of Berry County, there are 57 children under the age of 5, but only one licensed child care provider with the capacity to serve 13 children. It also has demographic data and median family income. You can also put in a city name or town name. I'll go to Grand Rapids, Michigan. Here you can see a number of child care providers in Grand Rapids. The dark blue are child care centers, and the light blue are family child care providers. I can also even put in an address. I'll put in, go to Katy, Texas, which is just outside of Houston, and that will zoom right down in on that address. The orange, of course, is child care deserts, and the gray are not. I can actually isolate the census tracts by whether they are urban or high density, suburban, kind of medium density housing, or rural. And I think one thing that's interesting that I found here in Houston actually is the southwestern part of the city of Houston has a ton of family child care providers, and this is actually an immigrant community with a lot of Vietnamese and Southeast Asian families, and there's a very vibrant, bustling family child care market happening there. So you can browse around at, again, childcaredeserts.org. I'm going to take us back to the slides and open this up for questions. I know that I've got some questions coming into the group chat here on the side, but the things that to kind of provoke your thoughts here are, I'm wondering, what kind of data you might be sitting on, or that your department or agency might have that you think could be analyzed geographically, and how do we move the public conversation towards solutions once we get people to accept the problem. And there's lots of ways to do a variation on this theme of child care deserts. There's an organization in Texas, actually in Houston, called Children at Risk, which whom we spoke with and did great work on child care subsidy deserts. There are opportunities to look for quality deserts. Certainly everyone knows, I think, that there's a real dearth of infant and toddler supply. Later on, we'll see from Child Care Aware how there's non-traditional hours is an issue for child care in parts of Massachusetts. So I think I can just actually look at the questions here on the side. Is that right, Jerry?
Yeah, and I've pulled them into a question list too. I don't know if
there. Great. Great. All right, I will just go through a couple questions now, Jerry, and then maybe wait, and then we'll move on, and I can address more at the end.
Yeah, we've got a few minutes, so go for it. As many as we can. Now. Great.
Okay, so the first question I see is, how did I choose the cutoff for at least 50 children under age 5? That excludes basically just very low population census tracts. Almost all census tracts have at least 50 children under age 5, but there are actually census tracts that are islands, mostly water, in a very remote parts of Colorado, and I didn't want those to be coded as deserts when there's really nobody there to serve. I'm hearing that people are interested in the tease that I gave on the Head Start report. I hope that will be coming out in March, and looks specifically at Head Start providers in rural areas who are doing really amazing work. Let's see, any stats for the state of Hawaii? That is something that we are definitely working on. I know that in Hawaii there is a real a lot of specific challenges regarding child care. And a really good question, this is based on residents, but what about families that rely on child care near the workplace? I think that is a really great point. It's certainly a limitation of this type of study. I think that we had to rely on a few basic assumptions for our analysis and for our definition to be as kind of simple as possible. One of the things that I think is a fair criticism is that there are going to be some families who use childcare near work. Certainly commuters, this could be an issue for rural communities. And we do see that in some downtown areas of cities we'll see a lot more slots than children who are living there because there may not be many families. So this is something that we're trying to address, and again, as part of the kind of working definition, we're looking to improve, but again, we're trying to keep it as simple as possible as to be a kind of binary definition, either a place is a desert or not. Once you get into kind of grades of deserts, I think the message gets a little bit muddled, but I'll leave that to others to maybe take up that mantle. We do have a process to share this data. I will share that resource with Jerry and Zelda to maybe put up as resources on the Center for Quality Assurance site. I think we just have a few things that questions that we want to ask to make sure that people are using it responsibly, but we're always happy to welcome those requests. Someone asked mapping software, what is it called? ArcGIS and QGIS are the two programs that I mentioned. A lot of great questions in here. I'm going to save some of them for the end so that the other presenters have time to talk. So with that, I will turn it back over to Jerry. Thank you very much.
Great. Thanks, Rashid. And I'm loving all of the comments and sharing that's going on in the chat box. I think when we download all of these comments, it's going to give us all a lot to think about in terms of future work as well. So thank you for sharing what's going on in your state and what you're thinking, what's kind of prompted your thoughts as part of this initial discussion. All right, so now I want to turn it over to Deanne Dobbins at the Child Care Aware of America. She's going to share an approach that they're taking in terms of mapping and what it's resulting in some very concrete changes and approaches in states as a result of the mapping process that they've undertaken. So Deanne, I will turn it over to you.
Thank you. As she mentioned, I'm Deanne Dobbins, the Senior Director of Research at Child Care Aware of America. And those of you who aren't familiar with our organization, we're a national nonprofit, and we do a lot of reports, and our focus is on a vision of quality, affordable, accessible child care for all. And you may be familiar with some of our work on the cost of child care, where we look at what parents are paying for child care. And we've often done a lot of work around looking at child care supply and demand. If you've seen our child care fact sheets that we release every year, you know that we report state-level stats on child care supply and demand. And in 2016, we did a scan of some state-level studies of folks who were doing child care supply and demand, and we shared state stories and lessons around folks have learned around measuring supply and demand and how they use their data. That report is called Child Care Deserts, Developing Solutions to Child Care Supply and Demand. We know that states, especially state agencies and child care resource and referral agencies, have been doing this work for years, so it's not new, and we don't claim to think that our work is new. But with the 2014 law, the Child Care Development Block Grant, we know that there's good reason to look at these gaps in supply and use the analyses to target resources. So while we at Child Care Aware of America we've used the term child care deserts in our first paper in 2016, we've kind of moved away from using that term as much because we have not been using a specific definition like CAP has. We've really been working at the state level to think about what are the issues that states are interested in looking at, what are the gaps that they're trying to get at, and really understand how they can target their resources when they see those gaps. So we sort of see ourselves in this middle area here where we know that there are folks mapping critical issues in their states. There are some state level and community level supply and demand analyses, and then you've got lots of the desert studies like Malik was mentioning, where especially they're looking at it at the national level using publicly available data and really kind of looking at desert versus not desert. We see ourselves sort of at an intersection where we're utilizing new technology, telling customized stories where we're looking at child care situations in specific communities, where we're working and collaborating and partnering with state contacts, encouraging them to get new partners as they think about how they'll use their data, how they use information that is displayed in this visual way, and then with an eye toward policy change and some advocacy efforts. So I think of it sometimes as the sort of the so what part of the work, so the really thinking about the deep dives into specific communities and really helping states think about their specific critical issues that they're interested in. Our mapping process is a little bit different than what we heard before. We're pretty collaborative. We work with a team in each state that we work with. We're in about 10 to 13 states with different timelines on each. But we have a process that we follow, and there are kind of some specific steps. The first is to really have strategic conversations with states to figure out what's their unique story. What do they want to tell? What do they think maps can help them push in terms of a policy change or in terms of an advocacy issue? Then we draft maps and review them with the state. So we do the first draft, we get their data, we make sure that it makes sense. Sometimes it's a series of back and forth questions and revisions because the data just doesn't look right, or we don't have the context a lot of times to understand what the data means. So we might have to do some different computations or use some different data. And this piece is really critical because we see the state folks as partners. Then we take the maps and we insert them into what we call a story map. We also use ArcGIS, but we use the story maps to kind of tell that story. So you'll see the map on one side of the website, and on the other side you'll see the story that goes along with it. And we work closely with the team to get the proper state context and tell the story that will help them make their cases once they make those maps. And once it's done, it'll go on our site with an overview of the report. We also create share kits which can be shared, where people can use the information to do social media sharing. And then we also provide a link to the work that we do to our partners so that they can also use it on their site. And the nice thing about the story map is that it's all kind of contained in the link. So if we decide to make changes, we'll make them on our end and it'll show up where it's linked. And then finally, we work with states to think about how they'll use their maps. And Jen will talk a little bit about that, but we kind of connect with them, our TA and advocacy team, and really help them think about their plan for going forward with it so that they just don't have the map, they have some work that can be done after. So these kind of questions that I have in this slide really helps you think about the kind of strategic conversation that we have with folks when we first start this work. And we really want to do this in the beginning because it helps them think about how they'll use the maps in the end as well, and who they want to have on board with them. What kind of elements could be the greatest catalyst for policy change? Who's the audience that you're trying to reach, and who else do you want to include in the process? A big piece for us is the relevant data, or the clean data, or the amount of data that they have, and what can be usable. So we work also with them to figure out, well, if you don't have the right data, are there people that you can bring on your team that can help you think about the right data? And so we typically will use a variety of sources. We typically work with child care resource and referral agencies in our work, but a lot of times they will partner with the state agency, and also we'll use publicly available data, and also we do use some of the census data that you heard about before. So this is what our story maps look like. As you can see, when you go to our website, childcareaware.org, usa.childcareaware.org, you'll get a teaser about the Map the Gap series, which is really what we're calling our supply and demand studies. And you can look, when you get on, you'll see that we have some very important context about the state, and then you'll see that there's like little files, and you can go to each of those files to see some of the data. So I'm going to actually take you to one of our websites. Hopefully you can see this. This is for our work that we did in Massachusetts, and I kind of like this one because, as you can see, they're the different folders that are a part of the story map. But what we wanted to do with this one, we worked with the state of Massachusetts, and they were very interested in mapping the availability of licensed child care slots that cater to workers needing non-traditional hours who were working at 3 areas of interest. So we had our specific ask. We were really digging deep into certain parts of the country. Certain parts of their state. So they knew that these casino jobs, most of them are 24 hours. They're open 24 hours. They have 7 days a week. People with young children need care during nighttime hours, early mornings, and weekends. So that state team wanted to see what the current supply of child care was, licensed child care was, in the 10-mile radius of those communities. So what we did was, as you can see, we started off by looking at the supply of child care during non-traditional hours in each of those 3 communities, and this is a 10-mile radius in each of those 3 communities. So we started by looking at the providers that are open on the weekends. Then we were able to look at the ones that were open before 6 a.m. As you can see, it's pretty sparse. We were interested in looking at what happens after 6 p.m. So this is like at the 6 p.m. witching hour, I like to call that, when I have to pick up my kids by 6 o'clock, or I'm paying extra. There's some that are open slightly after 6 o'clock in these areas. But then what happens when you look at the providers that are open after 8 o'clock? As you can see, you're getting fewer and fewer. Then after 10, very few. So, this information was really critical for them making the case. They had a pretty, they had an idea that this was happening, but to have it displayed in a pictorial way was really important and really helpful to them. Now what they're doing is we're tying that information back to the work that they'll be doing with the TA teams that we sort of transitioned to them. It's really that's just one map, and that's just one community that we worked with, or one state that we worked with. I'm going to forward these. I wasn't sure if the internet would work, so I did some screenshots. I also wanted to let you know that, so we have that map, the Massachusetts map. We also have a story map from Alaska, which is basically the Alaska map is about looking at infant toddlers child care and looking at the gap between supply and demand. And then we've released 2 new maps. The 2 ones that came out, they actually came out yesterday. So we have one of our new maps is New Hampshire. Again, we worked very closely with them to figure out what their issue was and what their concerns were. And New Hampshire was very interested in doing a supply and demand map where they were looking at sort of a clearinghouse of information about each provider in each zip code. And so we worked in partnership with the New Hampshire Bureau of Child Development, the Head Start Collaborative Office, and Child Care Aware of New Hampshire. And what we have some folks on, we have Tracy Pond on the call today who will talk a little bit about some of the work we've done with them in the past and how they hope to use this information. But we are able to provide a repository of child care information as a visual aid, and it's going to help them hopefully determine how they want to most effectively invest their resources for licensed child care recruitment, retention, and quality. But based on our analyses, we found that New Hampshire faces a deficit of over 22,000 licensed child care spots across the state, and that kind of translates into about 2 in 5 children in working families not having access to licensed care. So with this informational clearinghouse, the pop-ups in their supply and demand maps really shows information about the provider in each state, and it really provides a powerful visual aid in identifying the gaps. One of the other things that they were interested in was looking at a particular county. They knew that over the past few years they'd had an infusion of funds where a funder has invested in quality child care. And with that investment, they know that they were able to show and map that there's a relatively high ratio of high quality or accredited care. So they had 3 different levels, licensed plus, and accredited for this county. That's relatively high compared to other areas of their state. Now keep in mind it's a very rural area with few child care options. So although we're talking about a numerically small number of providers and slots, they felt that this was a really good way to show what can happen with some investment and with limited resources. The other map that I wanted to share with you that is new is the Minnesota map. And based on our analysis, we show that Minnesota has a deficit of over 80,000 child care slots, licensed child care slots, and that translates into about 1 in 4 children under the age of 6 not having access to licensed child care. And as Rashid talked about, Minnesota is one of those areas that does rely particularly on family child care programs. And so we know that's one thing that we've looked at with them when we talk about our cost of care and the cost and how how affordability is different between family child care and center-based. But there's a universe of child care options in Minnesota. They've got lots of braided funding streams where they're trying to support the needs of families across the state. And what Minnesota wanted to do is figure out the locations of the different types of child care providers in their state and really get a sense of where the locations were, where the providers were, where the children were by zip code, and we included the county boundary for reference. So for instance, in this map here, you can see all the different options for child care. There are over 10,000 child care providers with all the different types of programs throughout the state. If you were to go to the map, you would see, again, sort of a cascading map that would show you what happens when you're looking for the different types of child care. So this one is looking at the supply and the demand, the number of unmet slots in the state. And so when you've got the darker the shading, it means that there are more unmet slots. In the lighter, it's less. But if you also then look, what they wanted to be able to do is get a sense of what's happening for each option. So you could look, when you were in that map, you could sort of cascade down and see what was going on for the different types of care. So the one before was around family child care. This is their centers, and these are their home Head Start programs. They also have information on their pre-K programs. So it's just a really nice way for them to kind of get a sense of the different options. One of the things that they really are interested in is looking at high-rated quality child care programs throughout the state. And that's something that we want to investigate with them in the future, to really look at where those kind of quality gaps in care are. And we really we want to work with them to map quality by supply, map quality by cost, map quality by types of children, and by types of care, and other factors. And one of the things that they are really interested in is looking at how they can use this information to make the case that they need to invest more in quality child care. So when you get a chance, take a look at the Mapping the Gap maps, and there will be more coming forward throughout the year. What you'll see is you'll see the page that shows kind of this is what it looks like when you get there, and then you'll be able to look at each of the states individually. It'll take you to another site. It gives you a little bit of information about what we've found, and then you can go to the individual story maps where you have the stories. You can also download a report that's a PDF report that kind of gives you an overview of what we did. And then we, for some of the states, have also been able to provide a county-level cost of care supplement where you can see information about the cost of care at the county level for some of these states. So I'm going to, do you have
we've got a few questions for you,
Sure.
that I'll kind of go through and pull out as we go along. One person asked, can these be narrowed to the neighborhood rather than just at the county or census tract level?
Well, with our maps, you can zoom in and zoom out, but we did look at it at the zip code level. Now, some states have been interested in looking at it at the neighborhood level. Again, when we're working with states, our whole goal is to customize it, to make it so that they're telling the story that they want to tell. So I know in a couple of states where we're really concerned about the population, they wanted to sort of bring it back out to the county level or a higher level, but others are want to look at it in more neighborhood level. So what we would do is work with each state when we're doing this work to figure out where they would like to look at it.
There was also curiosity about the fact that you were showing more states than we're able to see on the web page. There were only 4 they saw on the web page, but it seemed like you were showing some more. You've got some others coming out soon, right? That'll be posted on the web?
Yeah, right now we have 4 Mapping the Gap states. And we, in March, we're going to be doing a special infant toddler Mapping the Gap piece. And then we have a couple of other states that will be rolling out over the next year. We have we have 15 states that we originally started working with, but I think we're going to really have mapping for about 10 to 13.
And and they'll just kind of roll out over a period of time?
We're rolling them out as we're finishing them. Well, yeah. And one of the things we would love to do is, as I mentioned, we kind of take that information, we have the websites available and the maps available, and then we transition those teams to our TA team. And so one of the things we want to be able to do is tell a whole story, kind of like from the beginning to end, and how things how they may have pushed policy or how they may have changed the policy through the work.
And we've gotten a couple of questions around the non-traditional hours data. Mm-hmm. People wondered, how was that data determined around non-traditional hours, and how did you determine the demand as part of that as well?
Yeah, we made some assumptions about demand by thinking about the fact that we were looking at a specific industry, the casinos, and thinking about the radius around those areas. But as far as getting the supply information, we work closely. The CCR&Rs that we work with, our partners, collect data on the licensed child care facilities in their community, in their state, and they have information on the hours that they are open. So then we were able to look at the times that were the slots that were the centers that had, or centers and the family child care providers that were open during the times that we looked at. And I see that there's also a question about looking at informal care during those non-traditional hours periods. Yes, that's one of the things that we could not do with the maps that we have right now. They are very focused on licensed child care because that was the data that we have available. We would love to work in a state where they have some information about the informal care that's of use during non-traditional time periods. And we pretty much know that those kids are going somewhere and that they probably are going to places that aren't necessarily in the licensed system. And so one of the things that Massachusetts has been thinking about is maybe some of the asks for this work would be thinking about how do we shore up those family child care providers or our family friend and neighbors to become licensed or to become part of that system so that they can be part of the system.
Great. Well, thank you so much, Dion. This is so interesting. And we will turn it over now to Jen Bump from Child Care Aware of America as well to share some of the examples in states of how this data is actually being used to change policy and funding opportunities as well. So Jen, take it away.
Thanks so much. Thanks for the opportunity to participate on today's call. I am Jen Bump, Senior Policy Advisor at Child Care Aware of America. We're going to share some examples today from 3 different states, not only of how these states have identified gaps in supply, but what the states are doing to address shortages in child care. We're going to do this through the lens of child care resource and referral agencies throughout the nation, and hopefully it will give you a sense of the possibilities in your own states. So when we want to drill down on how the work is being accomplished through mapping the gap, there's a real focus on the relationship and connection to child care resource and referral agencies. So we believe CCR&Rs are a critical ingredient in the recipe to address child care shortages, as they have decades-long track record of delivering community-based support services to families, child care providers, and communities. When we approached the Mapping the Gap project, we were looking at 3 things related to CCR&Rs to inform the current work for child care recruitment and retention activities for CCR&Rs, to use these maps as a catalyst to stimulate state and community-level collaboration to address supply and quality shortages, and to create opportunities to spotlight the robust capabilities of the CCR&R system within the United States. So why CCR&Rs? Again, these are the community-based child care experts that have a pulse on the needs of their states and in their local communities. CCR&Rs collect a tremendous amount of child care supply, demand, cost, and quality data. Many CCR&R systems throughout the country, they work every day to be in touch with child care providers to update data on those providers. For example, they capture information about vacancies, type of care, ages served, hours of operation, quality rating level, cost, providers accepting CCDF vouchers and other subsidy forms or financial assistance, even collecting data on child care providers that will offer drop-in or emergency care for families. So we really believe that CCR&Rs are key to this child care shortage. And so we we wanted to focus on our relationship. So here you'll see a map which highlights in blue all of the states that are involved in the Mapping the Gap project. Currently, we're aiming for 15 states. Our goal, as Dion mentioned, is eventually to reach all 50 states. Child Care of America recently conducted interviews with CCR&Rs in nearly all 50 states. It's important to note that we found CCR&Rs are actively engaged in building a supply of child care, but a lot of times they do not receive specific government funding for recruitment and retention services, but they still engage in that activity because they're the ones on the other side of the phone every day answering requests from families about how to find quality child care. And so they take action to address those concerns, even when funding is not available to them. So we're going to move to spotlight these three CCR&R systems. These states will show you a sort of a continuum of the different levels of engagement with child care supply and demand maps, and their progress towards implementing solutions and filling those gaps. So the first state that we'll spotlight is North Dakota, Child Care of North Dakota. They are a single statewide CCR&R system where one CCR&R delivers services throughout the entire state. They're just getting started in their child care mapping the gap work, but they're a wonderful example of what many CCR&R systems currently do or have the infrastructure to do with or without maps. The recent interviews that Child Care of America conducted with state CCR&R systems revealed that, like North Dakota, CCR&Rs use data and relationships within their communities to not only build the supply of child care generally, but to prioritize their efforts based on specific areas of need. For example, they may identify where there's shortage in infant toddler care, maybe where there's a shortage in CCDF-approved child care programs, and as Dion showed before, where there's a shortage of non-traditional hour care. These CCR&Rs, particularly this one in North Dakota, they have a intentional project where they train new child care providers, and they provide ongoing technical assistance to those programs throughout their first year in business. Also in North Dakota, like in many CCR&R systems throughout the country, they collaborate with the licensing office to help child care providers that may be out of compliance for one reason or another. They help them get back on track and ensure that those child care providers are still part of the child care options available to families. The next state that we will touch on is New Hampshire, and Tracy Pond leads the work in New Hampshire. She'll come on in just a moment and talk about her work, but we wanted to take you back a couple of years to when Child Care of America was just getting started in our Mapping the Gap work. New Hampshire was the first state that we selected to complete a proof of concept map. The map that you see here was designed after maps that were being developed in the Indiana CCR&R system as early as 2013. And these maps paved the way for mapping in the additional 14 states as funders saw what was possible in terms of mapping communities. So we also have a testimonial from Kristen Booth, who was the state CCDF administrator at the time that we started our proof of concept. Obviously, Kristen saw this as a great opportunity, just as a CCDBG had become reauthorized, saw it as an opportunity to leverage as a state CCDF leader moving forward. And so with that, I'm going to turn it over to Tracy Pond to talk about the different projects happening in her state to address supply and demand.
Thank you, Jen. Just to give you some context, in July of 2015, Child Care Aware of New Hampshire, we became the statewide CCR&R in New Hampshire. The state moved from 10 single CCR&Rs to one. At that time, we began an extensive amount of work to provide statewide services and still meet local and regional needs, and look for opportunities to build and strengthen relationships in this capacity. We provide a lot of training and technical assistance, and as a CCR&R, we provide a significant amount of professional development throughout the year with face-to-face trainings, webinars, full-day caring for our children, conferences and events. In addition, we are piloting an emergency operations planning cohort to assist programs with their emergency preparedness and their COOP plans in 2 regions of our state. We recently began recruiting licensed exempt providers in the northern region in Coos County, where we have really only 1 licensed family child care home. However, we have heard consistently throughout the years that there are a significant amount of licensed exempt providers in this region. We've developed a recruitment brochure, and a training and TA specialist is now actively seeking providers in this region so we can have more infant-toddler opportunities available to families who are struggling finding child care for this age group. We've also, actually at this point in time, our efforts are pretty new, but we've already heard from 2 potential providers with that effort. In addition, we provide a progressive training and TA program, and we're beginning our 3rd year providing this program to family child care programs and to center-based programs. This progressive training and TA program, essentially what it does is it packages our training and technical assistance, and part of the hope with this program is to help increase quality within the programs that we're working with. But within this pilot itself, this program, there's 5 training and TA options that programs can apply for. They can apply for a Strengthening Families option, where we provide training and resources to programs on strengthening families. We assist them with implementing the protective factors, and we help them complete the self-assessment. We also have an option of emergency preparedness. We review a program's current emergency prep plan, and we work with them to enhance their plan so it satisfies licensing requirements. We work with the programs on conducting response drills and solidifying their procedures around emergency prep. We also have an option of early learning standards. We train programs on the standards and assist them in implementing these standards into their practice. We work on professional development for staff, so this includes getting into our New Hampshire Professional Registry, helping staff with that process, working with them on teacher competency, assisting them in developing professional development plans, and then helping them apply for their credential. We also have an infant and toddler team initiative, and this is to work primarily with those infant and toddler staff within a program on the infant and toddler competencies, on applying for the infant-toddler endorsement, and we also work with them on implementing the early learning standards within those infant and toddler classrooms. The benefits to participating in this program are mutual for training and TA specialists and providers, as it has helped us establish strong and trusting relationships with our program and with theirs. It also gave us an opportunity to work with programs that were new to us as their new statewide CCR&R. In addition, it has taught programs how to implement meaningful change in their program and work as a team. As our training and TA options were created based on proposed standards of an enhanced and revised QRIS that has been worked on, our intention was also to help programs satisfy aspects of what is coming when that QRIS is brought into fruition. In addition, programs receive training hours for staff and TA. With our recent licensing rules changes, TA can now be used by individuals towards their professional development hours as well. In 2016, our agency received a 1-year grant through the New Hampshire Charitable Foundation to support programs reach our current quality designations of License Plus or NACCE accreditation through what we call our Quality Investment Initiative. We began providing training and TA to programs to assist them with becoming License Plus, or we work with programs on the NAEYC self-assessment process. Within this first year, we had a total of 5 cohorts that received training and TA from a training and TA specialist, in addition to mentorship from our quality investment mentors who were directors who work in a Licensed Plus or accredited program. 4 of those cohorts were Licensed Plus, and 1 was for the NACCE self-assessment. All participating programs, a total of 33 programs, became Licensed Plus, and 2 of the 3 participating programs began the NACCE self-assessment process as a result of this program. This past October, we were asked to continue this work by the New Hampshire Charitable Foundation for a second year to support programs. However, this time we were asked to use it as an opportunity to pre-pilot the preparatory level of the revised and enhanced QRIS. This prep level is being referred to as License Plus 2.0 and is being piloted in our greater Manchester and Upper Valley regions of the state. This pre-pilot is being done collaboratively with the Bureau of Child Development Head Start Collaboration and will help inform their work on the enhanced and revised QRIS. We are also utilizing the same cohort approach with mentors as well. Thus far, we have marketed the program, have actively recruited programs, and some of the first cohort meetings have occurred. We currently have 19 programs participating, one of which is a Head Start program. We have just opened up our QII up to programs who are currently Licensed Plus but are up for renewal during a certain time period. In addition, we are continuing our work with the 2 programs seeking accreditation and have additional programs that are being added to this cohort to support them through NACCE self-assessment. We envision 2 to 3 cohorts on License Plus 2.0 and 1 on NAEYC. As our progressive training and TA program has programs focusing on standards of the enhanced and revised QRIS, we envision that we will be able to see a direct correlation between the work we are doing as a CCR&R through our progressive program and where programs are at when they begin the QII, as these standards are part of the preparatory level. These are just some examples of the projects that we've been working on, but I think both have been driven by a lot of the work that we've done with mapping. I'm looking forward to seeing how we can map things in the future after we complete what we're working on now.
And Tracy, just a couple of questions before we move on to Natalie as well. One person asked, how did you get the rules changed to include TA and licensing training requirements?
That's an excellent question. We have a very strong collaborative relationship with licensing, but we're also providing a great deal of technical assistance, and we have been for a number of years. When we first started, TA we were kind of referred to as more like the help desk, helping them with the registry. But because we're seeing such a change in program behavior and how they implement change, it's definitely considered a professional development opportunity. And we talked to licensing about incorporating that into the rule revision process. We also use the TTAM, which is part of the NDS suite of data services, and our registry has the ability to give people a TA receipt so that they have documentation of those hours as well.
Great, thank you. I'm going to move on to Natalie, but one more question for you. We've had some questions asking if it's possible for you to share your recruiting materials. Is that possible?
Oh, yes, absolutely. Mm-hmm.
So if you'll send them to me, we'll get them posted on the web page for this webinar, and that way everybody will be able to access them that way if that works.
Okay, sure.
All right, there are more questions, but let's keep on moving. And Natalie, I'll turn it over to you.
All right, hello everybody. I'm Natalie Brigg from Early Learning Indiana, which is a statewide organization in Indiana that helps serve our child care resource and referral system, supports their work in the communities. Want to take a look at some of the ways that we have used mapping to implement strategies and successes that we've had around that. So the example map that you're looking at right now was created when we had the piloting of our On My Way pre-K program, which is a state-funded legislated program that supports grants for 4-year-olds from low-income families to have access to high-quality care. So what you're looking at on here was actually used as the model for the mapping project that Child Care Aware of America is now doing with the multiple states. It compared our QRS data of our facilities to the concentration of children with CCDF vouchers. So you can see that it's a saturation map. And it was done in partnership between our Child Care Resource and Referral State Network and our CCDF administrator to pull that data. What we did with that data, a couple of things that we used for the strategies. I'll point out here that these maps were used not in the same way that previous maps have been talked about on this call to make the case and involve others in the stories for care. They were really used and targeted at strategies that could do a successful rollout of the On My Way pre-K system, a successful rollout of outreach through our Child Care Resource and Referral to CCDF providers, So this map was used for the state to do some targeted capacity building through our child care resource and referral networks. So they were able to look at providers that were in high-density areas for CCDF usage and target them to come onto the QRIS system, to get onto path to quality in order to advance them up to the higher levels. It was also used to target outreach to CCDF providers when there were new CCDBG training requirements to make sure that those who needed them were getting them in a timely manner. And it was used for informing recruitment efforts. So when we did have providers then that were at a recognized level on our QRIS system to participate in the On My Way Pre-K initiative, and they needed to make sure that they got families to access the On My Way Pre-K vouchers and be in the right seats, they could use these saturation maps to see where there were the highest populations of CCDF eligible families and target in that area. One of the things that came out of the use of those maps is we really wanted to use them to propel interest in problem solving. So I know it's something that's been said previously on here, but would like to point out the fact I strongly believe that in Indiana we had success because we had multiple stakeholders engaged in this. We had our child care resource and referral system. We looked at using our community partners and using the mapping as a catalyst for action. So it is not only about the fact that we have the maps, but what are we using the maps for to make sure that we're successful in our strategies. So since then, we have had several multi-million-dollar investments that have been coming from both private and public sources. I want to point out that it is not an equation where it's create a map, you get some money. However, if you're able to utilize your maps to the best of your ability as tools, you can create a dialogue that can bring people into the story to invest both on the private and the public sector. So some of the examples of how this has been leveraged within Indiana, we have, as mentioned previously, the On My Way Pre-K initiative, which is state funding for pre-K. The City of Indianapolis came alongside that and did an Indy Preschool program, which offers grants for both 3- and 4-year-olds. We've had investment through our United Way of Central Indiana to really focus on a quality improvement project in order to help providers advance through the QRIS system with some of that TA, with some of that mentoring and coaching to give them additional supports. We've also had, through the Lilly Endowment, investment into Early Learning Indiana, and we've been able to focus one of our strategies within our promises to the Lilly Endowment through their funds is to increase capacity of high-quality providers, high-quality spots across the state. We've done that through initiatives that targeted family child care cohorts and used our child care resource and referrals for them to target areas where a cohort model could support a large number of family child care moving along the QRIS system. And through targeted capital improvements to supplement what is going on both through state funding and through private funding with our child care providers. So that number that is there, the 1,301 new high-quality seats created, came directly through engagement by Early Learning in Indiana to providers to add on additional seats. So as we look at what has been used or what maps have been used for, and we talk about investments that have been made in the state to continue the conversation, I know that this is not a new issue. I'm very excited to see that from Indiana, we have some of our child care resource and referral staff who've been engaging in the participant chats. This has been an issue historically for Indiana and for every other state as to do we have the right capacity for care. We look at there are many factors that go into the right capacity for care. It is not just are the seats there, but what is the enrollment? What is the cost of care? Do we have qualified staffing to provide that? So as we look to what is going to be happening in the future in Indiana, we've tried to learn as much as possible from what we've used mapping for, what we can go to use mapping for, and how we can inform that moving forward. Some of the current initiatives that are starting now and will be going on through the next year or so, and we'll be able to measure impact and effectiveness through. We have had an expansion of our On My Way Pre-K pilot program from 5 counties to 20 counties. So those same maps that we looked at a few moments ago that were used in those 5 counties, we are now redoing the maps. That data from the CCDF usage and saturation is a couple years old now, so we're redoing them with current data. and allowing then for, in all 20 counties, there now to be an updated map for those same strategies to be used again. Can we help target providers that need to come onto QRIS? Can we help the providers do targeted marketing in order to make sure that those slots are filled? We also recently had an opportunity through our Office of Early Childhood and Out-of-School Learning that there was a capacity building grant. As part of that capacity building grant, there were priority points that were given to applications from counties that had 0 high-quality providers, as well as counties with substance abuse disorders, concerns. So looking at mapping on the most basic level of just county by county, if we've identified absolute deserts where there are 0 high-quality care, where can we give priority to them when we do statewide initiatives? We look at continuing to reach out to audiences with tailored message for collaboration between local, regional, and statewide partners. We want to look at how we can best utilize mapping as a tool to tell the story and engage audiences, moving them towards that purposeful action, and then ensure that we're also using our data as best as possible to represent the areas and put those tools into the hands of our child care resource and referrals, our community partners, and let them use them as a tool to ensure that there's success of the strategies that are being used. And with that, I'm going to turn it back over to Jen Bump to kind of wrap up our section.
Awesome. Thank you so much, Natalie. Thank you, Tracy. We wanted to just now take an opportunity to draw from the great experience of all of you. So a poll question, does your state CCDF office invest in child care capacity building activities? So we just want to know what's going on out in the states from your perspective. Okay, great. It's like we have a lot of aren't quite sure yet. That makes guessing some of you may not be all too familiar with the work of the office, but always encourage to connect with them. Like
Jen, you're breaking up a little bit.
Oh, okay. How's this? Is this better?
Yeah, it's better.
It's like saying that the state engage in this. And yes, they are engaged in funding for in your states. If you can mind, go ahead. What you know you're doing for
so you are still breaking up. I don't know if but I'm assuming you're asking that everybody now answer this next question of how your state builds capacity.
You got it.
And if you don't know if your state's actually engaged in this work, you might say instead how you wish they would be working to build capacity and what that would entail as well. That might fit for the half of you that felt like that you weren't sure that what your state was doing.
And Jerry, I'm not sure if you can hear from.
We get out the first part of the sentence and then it crashes.
Okay, I'll try one more thing.
Okay.
Is this working better?
Yeah, well, right now it is.
Okay. Well, I just want to thank all of you who are adding your comments here, either about what you wish your state was doing or what your state is actually doing. Also want to encourage you to reach out to Child Care of America. Dion and I have been doing quite a bit of work with states. If you're curious about what's happening in your state, We can both share with you our knowledge of state activities and connect you with the CCR&Rs in your community to learn more. So with that, Jerry, I'll turn it back over to you.
Thanks so much, Jen and Natalie and Tracy and Dion and Rashid as well. I appreciate all the time you've given us today and sharing the great work that you're doing. And it's so exciting to just hear what the possibilities have been in New Hampshire and in Indiana in terms of your follow-up as part of this work. We want to just take last couple of minutes. I know people are ready to go, but one of the things the federal government asked us to do as part of this webinar series is to find out what you thought about it and whether it was useful or not, so they can determine whether we need to do more of it or less. So if you wouldn't mind just in these last couple of minutes answering a few questions, we'd appreciate it. And I was skeptical that people would even take the time to do this, but on the last webinar we got a great response. So please do take a couple of minutes to answer these questions, just three very quick questions, and then we'll wrap things up. Zelda, anything you want to add as part of the wrap-up to this webinar as well from the perspective of the Quality Assurance Center?
No, Jerry, other than very, very informative and very helpful in thinking through how to get at and address the disparity and the availability of care in your area. So definitely I would encourage everyone to reach out to Child Care Aware, reach out to Rashid. They are all both very interested in working with your state, also checking with your state administrators and the leaders in your state about the mapping and about assessing the availability of care if you're not sure what efforts are being done in your state. And again, thanking the speakers for doing a great job. And we've had several questions in the chat box about when the recording link will be available. We'll be sending an email out after the webinar within the next few hours that gives you the link to the recording and the slides, or you can go directly to the web link that we've shown in the chat box a few times today. If you go there, that's where the link gets recorded. Feel free to share that link with anybody. It has the slides, the recording link when it gets posted, not only for this webinar but for the last one and for the ones going forward as well. And so we'd love to make sure as many people take advantage of it as possible. And you will get that email by tomorrow morning at the latest. All right, one last question. Tell us what we can do to make this more useful and improve the webinar for you. And again, echoing what Zelda said, thanks so much to Child Care Aware of America and Indiana's Early Learning Partnership and Child Care Aware of New Hampshire, and to Rashid at the Center for American Progress. Such amazing resources that you have to share, and I appreciate your generosity in sharing your time today and going forward. We got quite a few questions that we did not get to, and a lot of fantastic comments as well that we will be sharing with our speakers today to help inform their work, to help inform our work at the National Center for Early Childhood Quality Assurance and with BUILD as well. And look forward to taking what you're sharing and offering some other opportunities for learning going forward. With that, thank you very much. It's 3:30 in the East. If you've answered this last question, I appreciate it, and have a great day. Take care. Bye.